Hello, I'm Dr. Paul with the Body Intelligence Center, and we have Mr. Skeleton right here. I just adjusted a patient using mild skin resistance adjusting, which is something I'd like to explain to you that I developed here in the office. Everything is connected, and so you've got the skin on the surface of the skull. You've got underneath of the skin, you've got tissues, right? You got muscle tissue, and the deeper you go, you got bone, and then you've got joints that are even deeper. There's no the bone and the joints, you got the skin, the muscle, and the joints underneath it in the skull. So in this particular patient, she was feeling vertigo and dizziness. And what I found is when I treat my head, the vertigo goes. So the difference between vertigo and dizziness is that vertigo, you spin, the room spins around you. Dizziness is kind of like lightheaded, you feel like faint. So the common causes of vertigo that I have found are cranial misalignment. So it could be from general inflammation from three causes: physical, chemical, emotional. So you have to address all three and figure out which one it is. So I'm going to just focus in on the physical component today. But I find that cranial work should be in high demand because there's a lot of cranial injuries, not only from physical injuries, but from chemical inflammation. And the topper of it all is probably emotional inflammation. Now, you know that when people get, like for example, the association between a psychosomatic relationship, which is psycho-emotional, somatic body, is when you don't forgive somebody and you hold on to unforgiveness and turns into bitterness. That turns onto your body and you hold that, and it can turn into inflammation in your body, causing pain, causing cancer. So you probably have heard that before. But I'm going to focus in on the physical component today. So when I adjusted her, I checked what's causing the problem. The first thing I did was I went to the back of the skull right here, and I checked the tissue resistance of the skin and just went back and forth, and we call that anterior posterior motion. So here's anterior, posterior. So anterior, posterior, I'm moving the skin very lightly on the surface of the skull, on the bone, and I check the resistance of the skin. If the skin resistance moves more this direction here, backwards towards the skull, then I know the problem is pointing to the direction of ease. So in this case, it's moving easier this direction. So the problem is probably in the back of the skull somewhere, in the direction that it's easy to move the skin. So I adjusted it in the direction that needs to go, which is the direction of resistance. So this is the ease, this is resistance. So I'm going to adjust it this direction by moving the skin. So I just put my pressure right here. You don't have to do it the way I do it, but you can just push like this and just hold until it releases. So there's some advanced techniques, but I'm just going to do it without any advanced techniques now, and I'll show you the advanced techniques later. So you push, you hold, have them breathe in and out, and this is where you feel with very light pressure how the breath affects the motion. Okay, meaning that if it hardens the resistance, you wanna adjust it and push it a little bit harder in that resistance. So if say the patient takes a deep breath in and it hardens right there, well, you hold it firmer. Okay, and the way I do it, I release my hands quickly like that. And when I do that, it's an electrical thing, myofascial release thing, whatever you want to call it, but it just works better and faster in my opinion. You can just hold it in place. Oftentimes when I find a resistance like that, it's tender. So that double confirms me that there's an issue. It's like the skin saying, I'm hurting, give me some help, give me some TLC. So to refresh, you push in the direction of resistance, just hold it there, and then as they breathe in, if they feel resistance on breath in, you hold it there and just push a little bit firmer, and then if you feel resistance on the breath out, you push again at that point of resistance. And if you want to practice on quick release techniques, no pun intended, you just go like this and you do it quickly. And that, sorry, Mr. Skeleton is falling off the table. And that will allow, and then you feel it afterwards, and the resistance, I'm having trouble here, Mr. Skeleton. You'll feel the resistance go. The skin moves better. So I recheck, oh yeah, that feels like it's moving now. The other thing that I did with her, I'll tell you on the next visit, because she did have a neck she had a neck misalignment, and I'll talk to you about that on the next video. I'm Dr. Paul. See you next time.